Plaque psoriasis. Symptoms, treatments, and complications. Plaque psoriasis is a chronic autoimmune condition. It appears on the skin in patches of thick, red, scaly skin. According to the National Institute of Arthritis and Musculoskeletal and Skin Diseases, plaque psoriasis is the most common form of psoriasis. It affects about 6.7 million adults in the United States. Plaque psoriasis can be a very itchy and sometimes painful condition. It also can be embarrassing and doesn't always respond to treatment. It's sometimes misdiagnosed as another skin condition, such as dermatitis and eczema. Plaque psoriasis typically involves patches of rough, red skin and silvery white scales. This is because the skin cells receive a signal to produce new skin cells too quickly. They build up and shed in scales and patches. This buildup of skin causes the red and silvery patches, as well as pain and irritation. Scratching can lead to broken skin, bleeding, and infection. The severity of psoriasis. Psoriasis classification is based on its severity: mild, moderate, or severe. Your doctor will first determine the severity of your psoriasis based on how much of your body is affected. Mild psoriasis covers less than 3% of the body. Moderate psoriasis covers between 3 and 10% of the body. Severe psoriasis covers more than 10% of the body. The severity is also determined on how the condition is impacting your day-to-day life. Patches of plaque psoriasis. The most commonly affected parts of the body include the elbows, knees, and scalp. Most people with plaque psoriasis will develop patches in these areas. But some will also have psoriasis patches on other areas of the body. The location of plaque psoriasis can change as patches heal. New patches may appear in different locations during future attacks. Plaque psoriasis affects everyone differently. No two people will experience the same symptoms. Plaque psoriasis and the geography of the body. The distribution of psoriasis patches on the body can appear randomly. Some patches may cover large portions of the body, while others may be no larger than a dime. Once a person has developed psoriasis, it may appear in a number of different forms in many different places. Unlike inverse psoriasis, plaque psoriasis doesn't usually affect the genitals and armpits. Plaque psoriasis and its reach, the scalp and beyond. According to the American Academy of Dermatology, at least 50% of people with plaque psoriasis will experience a bout of scalp psoriasis. Plaque psoriasis on the scalp may require different treatment than plaque psoriasis on other parts of the body. Medicated ointments, shampoos, and careful removal of scales can help treat scalp psoriasis. Sometimes, systemic medications must be used to clear plaque psoriasis on the scalp. Pervasive plaque psoriasis covering the body. In some cases, plaque psoriasis can be very severe. It may cover the majority of the body. Plaque psoriasis of this severity can be uncomfortable, and even dangerous, if it becomes infected or progresses to other forms of psoriasis. Moderate to severe plaque psoriasis can be treated effectively with different types of therapy, including biologics. Severe cases will often require a specialized treatment plan developed with a dermatologist. Prescription systemic medications may also be necessary. Pictures of plaque psoriasis. Diagnosing plaque psoriasis by looking at the skin. Most doctors and nurses can tell if a scaly or rough patch of skin is psoriasis. Sometimes a biopsy or a visit with a dermatologist is needed. During your visit, make sure to point out all of your abnormal patches of skin. Tell your doctor about your symptoms and what seems to aggravate your skin. Possible triggers of psoriasis include skin trauma, medication use, dry skin, stress, excessive sun exposure, certain lotions or skin creams. Don't attempt to treat or diagnose psoriasis without consulting with a doctor. The least pleasant view of plaque psoriasis. Excessive scratching can cause the skin to break. Open psoriasis patches can allow infection to enter the skin or the bloodstream. Infections can be a serious complication of plaque psoriasis. Signs of infection include leakage of pus, swelling and redness in the area, sore skin, foul smell coming from the broken skin, discoloration, fever or fatigue. Seek medical care for a suspected psoriasis-related infection.